SigTalks, Episode 026, Dr. James Sigafoose's Whiplash Video. Today's episode is brought to you by Sigafoose Weekly, a self-consulting program from Sigafoose.com, a $129 per month program that gives you everything you need to make massive changes in your practice and in your personal life. The program consists of the Sigafoose Systems Manual with over 200 pages of office growth and procedures and CA education and office marketing ideas, a private Facebook room that is only for people who have subscribed to the Sigafoose Weekly program, so you have a worldwide network of like-minded people who are philosophy-minded chiropractors. And if that's not enough, you're also getting the weekly consultation call by Dr. James M. Sigafoose himself. You get all of this for $129 per month. So let me ask you this question. What's holding you back? Isn't it time you become the chiropractor you always knew you could be?
Hello, and welcome to SigTalks with your host, Dr. Carrie Sigafoose, your home for the chiropractic philosophy, where we discuss the teachings of Dr. James Sigafoose, from his writings to his talks and his many audio presentations.
In this patient education video, Dr. James Sigafoose discusses the physics of whiplash trauma, educating your patients on what happens when this type of trauma occurs. In only about 9 to 10 minutes, Dr. Sigafoose goes through everything, but the most important aspect of this video is that he teaches your patient that even though they may be a personal injury patient at the time, their trauma is a chiropractic condition. With that, here's Dr. James Sigafoose.
Whiplash is as a result of auto accidents or some slip or fall that makes your head fly back or fly forward. The reason they call it whiplash is the tip of a whip, if you were to flick it such as this, the tip of the whip flies back, comes around and smacks and makes a smacking noise. That's what happens to your neck. Your head weighs about 18 pounds. When an automobile comes up behind and strikes you from behind, and or if they strike you from the front, what happens is that your head snaps back, goes forward, snaps back again, and goes forward again. Now, if you would understand the mechanics of that, here's an 18-pound head on a very slender neck that goes forward, backward, backward, beyond its limitations. So what happens is that it stretches the ligaments, stretches the tendons, and injures all the soft tissue in the neck. So many times you can be in an auto accident and you can have a car comes along. It's about a 4,000-pound car and it's doing 20 miles an hour. When it strikes you, if you take that from the law of physics, it would be 20 miles an hour times 4,000, which would be 80,000 foot-pounds of energy going through the car. Now, as it travels through the car, since you're an occupant, you're a part of the car, that same amount of energy goes through you. So we have a tremendous amount of jarring and tearing and spilling of tissues in the body as a result of this traumatic event of one car striking another, or your car striking a wall, or whatever the case may be, or simply slipping on the ice or whatever. Anything that snaps us back and forth and creates energy through the body. So when that happens then, since we have so much soft tissue damage, it's very difficult to prove, and what goes on is the front of the ligament. There's a ligament in the front of the spine. When the neck bends way back, it tears that ligament. There's a ligament in the back of the spine. When the head goes way forward, it tears that ligament. Then there are ligaments on either side called cruciate ligaments that keep the neck from falling over this way. They're torn like this. Then we have a disc in the middle that's very soft, and inside there's a gelatinous material, and it has a fiber material around it, and it actually adheres to the bone above and the bone below. But we can tear those little fibers that adhere to the bone. And so we have a great deal of soft tissue damage, and we have eruptions, small blood vessels erupt, blood vessels leak into the muscles, the little cells that make up the muscles and the soft tissue open up, and the inside of the cell spills out. So there's a lot of soft tissue damage, a lot of inflammation as a result of this soft tissue damage. It creates a great deal of pain, headaches, dizziness, a lot of neurological problems as a result, because the nerve comes off the spinal cord through a little hole like this. Now when we do this or do this, we tear actually sometimes the nerve, we encroach upon the nerve, so we now have neurological involvement, soft tissue involvement, and we have many, many problems that erupt from this, such as headache, prevalent after a car accident, stiff necks after a car accident, weakness of the neck, weakness of the hands and arms, pins and needles in the hands, chest pains, visual disturbances, loss of equilibrium, pain in the temporal area, and pain in the TMJ, pain in the teeth. Sometimes the teeth are knocked loose in an accident. So we've got so much damage as a result, it really needs care. Now what happens is most people with whiplash take drugs of one kind or another to remove the pain, take muscle relaxants to allow the muscle that is very tight as a result of trauma to relax. They take nerve pills, they take a variety of drugs trying to overcome all the symptom expressions as a result of this trauma. That's not good. Sometimes we see them walking around with collars on their neck, holding their head up. You see, the most thing, what that really needs is motion, because the more you keep it still, the more little fibers grow together, and we have little spicules growing together, and then it becomes fibrous, and you completely lose the motion in your neck. You don't want to do that. What needs to be done is that as a result of identifying the soft tissue through x-ray and through EMGs and through muscle testers and through nerve testers and vascular testers, we can determine how much and where the soft tissue damage is. Then we can gently adjust that spine, moving bones, getting motion back into the spine, breaking down fixations, getting rid of adhesions, allowing a greater vascular flow in the blood, allowing less neurological involvement, and ultimately allowing this neck region and spinal region to heal up completely, thus preventing problems down the road. Now what happens is, when it's not taken care of properly, when we treat it strictly through medicine or strictly through fixation or strictly through physiotherapy, you can look at that spine and see it change in the next 6 months, and then you'll see it in a year, it'll change again. And each year it goes by, we finally have more and more degeneration. We have arthritic changes, we have spurs coming off of the vertebrae, we have vertebrae shortening and getting smaller, we have thinning of the disc where we almost have bone up against bone. We have a tremendous amount of problems within the eyes and the ears and in the hands and the arms. And oftentimes we affect the heart, because the nerve to the heart comes out of the neck right here. And so we've got all of these physiological problems and all of these changes in the bone and changes in the structure and thickening the ligaments and tendonitis and arthritis and all of these things as a result of not managing a whiplash properly. So what I want you to realize, if you've been in an accident, whether you think it's a minor accident or not, it can't be a minor accident if 40 or 50 or 60,000 pounds of energy went ripping through your body. There's something going on there, and there's soft tissue damage, and there's symptoms to let you know that there's something wrong. So rather than hide it through drugs or hide it through fixation, please, I want you to understand, let the chiropractor examine your spine. Let's find out through an EMG what the electrical potential of the muscle is. Let's find out how much nerve pressure we have. Let's find out how much joint motion we have, how much nerve involvement we have. And when we can have all that together along with the x-rays and then measure, and there's a proper way of measuring exactly how much loss there is in the foramen or the hole where the nerve comes out, then you can look at this and say, well, now there's an impairment here. This person has permanent impairment, and then you would have an impairment rating, and you could logically then receive the care that you need and be able to do this thing from a very scientific viewpoint, not a haphazard viewpoint, not just based on symptoms, but based on facts. And so a proper care of a whiplash is very important, and proper care of whiplash through chiropractic makes all the sense in the world, because as the chiropractor is trained in the spine, he's trained in the nerves as they come through the spine. He knows the anatomy and the neuroanatomy of the spine, and he realizes the physics of this trauma from one car striking another, or from falling or twisting or slipping or doing whatever, whether it's in a car or on the job or falling down the stairs. He or she understands this from a law of physics. He understands it as a result of his training or her training, and he or she then can make corrections that will prevent 2 or 3 or 4 or 5 years down the road of your having severe damage in the spine, severe damage in the soft tissue, severe neurological damage, and perhaps irreversible problems that could be headed off at the pass if we would do it properly in the very beginning. So I want to encourage you to have your chiropractor examine you. I want to encourage you to stay with the chiropractor long enough to get the job done. And I want to encourage you to do what's necessary as far as regaining the mobility and the motion of your neck and your spine, and prevent yourself from long-term disastrous, irreversible damage due to improper management. So, whiplash is a very serious thing. Whiplash occurs, God knows how many times a day in your own town. As a matter of fact, in my own family, I've had whiplash injuries occur from auto accidents. God knows how many families are allowing these things to go on untreated from a chiropractic viewpoint, and having problems that develop that are much more serious than they should be or could be. So take a hint. If you've had an auto accident or a fall, I want you to check with your chiropractor, let him or her completely examine, find out what's going on, determine whether you have an impairment, and then do the thing that's necessary for you to regain total health.
And we're back. So, chiropractic treatment has been a great source of relief for many people who have suffered from whiplash. What exactly is whiplash, and how does chiropractic help, though? Whiplash is a description of how the injury has been sustained. It is not a disease and not in itself a diagnosis. Rather, it is a descriptive term that describes the mechanism of injury. Anytime the spine is unexpectedly moved in one direction and then it rebounds in the opposite direction, there is the possibility of developing a whiplash type trauma or injury. It can happen in a backwards and a forward direction, or it can be in a side-to-side motion. Of course, whiplash type injuries are not limited to motor vehicle accidents alone. Sports injuries, knocks, falls, and slips can all produce a whiplash type injury. The term whiplash type injury is used to describe any injury mechanism where there is a sudden excessive extension followed by an immediate excessive flexion of the neck that results in damage to the muscles, ligaments, and tendons. We now know that whiplash type injuries frequently do not result from just excessive extension or excessive flexion. Extension and flexion beyond normal limits of motion, that is, but rather an extremely rapid extension and flexion that causes the damage. Most whiplash sufferers have misaligned vertebrae in their spine. Whiplash type injuries usually involve a combination of nervous system, muscles, joints, and connective tissue damage. There are different degrees of whiplash type injuries, and in order to decide the appropriate treatment, it is important to understand the mechanism of how whiplash type injuries occur. Chiropractic care is a useful way of treating whiplash. There are a number of different treatment modalities that your back to health chiropractor might consider. One, the main treatment a chiropractor would provide would be a gentle spinal adjustment to the spine as required to reduce inflammation and irritation to the nervous system. A second way would be massage, stretching and strengthening exercises for neck muscles that are specific to the affected region. Three would be relative rest. Now, it is important in the initial phase of treatment to reduce exercise and movement that aggravate the problem to a minimum and reduce inflammation, whilst at the same time continuing with other activities that do not affect the condition, such as swimming and other low-impact aerobic activities. This is a concept often termed relative rest. My favorite part of this entire video is that Dr. Sigafoose sticks to his chiropractic philosophy and does not take the whiplash trauma into the medical realm. As always, this video and all of the patient education videos are available for immediate digital download at sigafoose.com. Next week, we'll be going over Dr. Sigafoose's last video called If You Don't Know Subluxation, You Don't Know Chiropractic. Until then, take care, and I will see you again soon. Bye.
Thank you for joining us today. If you're interested in more of Dr. Sigafoose's material, head on over for your daily dose of chiropractic philosophy to www.sigafoose.com and register for our free newsletter and to find today's audio clip of Dr. Sigafoose in its entirety. Remember to give, love, do, and serve.